to the consulting room. Today, our topic of discussion is understanding ADHD, Attention Deficit Hyperactivity Disorder. And I have with me here Dr. Gloria Amponsa-Kudua. I'm your host, Dr. Irene Obeng. We'll take a short break, after which Dr. Amponsa-Kudua will introduce herself. Welcome back. For those who are just joining, the topic of discussion today is understanding ADHD. And I have with me here Dr. Gloria Amponsa-Kudua. Dr. Gloria, you are welcome.
Thank you.
Please, can you briefly introduce yourself to us?
Sure. Greetings to you viewers. I'm Dr. Gloria Amponsa-Kudua. I work as a pediatrician, children's doctor at the Ejiso Government Hospital in Kumasi. And I'm also the founder and executive director of Healthy Kids Foundation. We educate the public on conditions affecting children, and then we also help children with special needs in terms of rehabilitation and then education. So basically that's me.
Okay. So Dr. Gloria, when we say ADHD or someone has ADHD, what do we mean?
ADHD stands for Attention Deficit Hyperactivity Disorder, and it's a recognized medical condition. It affects the part of the brain that is involved in executive function. So when we say executive function, the part of the brain that will help you to focus and complete a task, that will help you to have self-control, so you don't just do anything you feel like doing. And so when that part, which is the frontal lobe, so the brain has so many parts. The frontal lobe is the part that sits right behind the forehead. And that's the part that deals with executive function. So to sit for long periods, to concentrate, perform a task and see to its completion, and then not be impulsive, and then be able to sit still for longer periods whilst you are doing that task. That is the work of the executive, the brain, which is the frontal lobe, the frontal part of the brain. So when we say a person has ADHD, that means there's a problem with that function of the brain, and that results in the person having attention problems, being hyperactive. Sometimes they have both attention problems, and then they are also very hyperactive, and then impulsivity. So whenever something comes to the person's mind, he has to do it. So a problem with self-control. And usually for us to say this person has ADHD, it should have started before age 12. So you couldn't have been developing normally and then at age 45 start having these features, and then we say you have ADHD. So for those ones, we'd have to look for the cause. But for ADHD, we should have started having the symptoms in childhood. That is ADHD.
Okay, thank you. So how does this affect children in the classroom?
All right. When a person has ADHD, the telltale signs, so they are the ones who usually would raise their hand before the teacher will even finish asking the question. Okay. They will cut through a conversation, so they won't wait for their turn, have difficulty waiting for their turn. They say whatever comes to their minds. And then there are also the children who are always fidgeting, or they sit in this chair, the next 5 minutes, they are in the other chair, or they are poking somebody, they are nudging somebody. They have difficulty sitting still for longer periods, and they are easily distracted. So even if they are in the classroom and the teacher is teaching, a bird flies by the window, the attention goes to the bird. So very, very, very hyperactive, difficulty sustaining attention, very short attention span. These are some of the signs or symptoms what will let you know that this child is struggling with attention deficit hyperactivity disorder. And they also have difficulty planning. So you see, they know that in the morning I have to do this, then this is meal time, this is getting ready for school time. When I go to school, I need to pack my bags. Sometimes they go to school and they come home without their bags. They lose things easily. There was a child who came home without his school uniform. Can you imagine? So they lose things easily. So issues with attention, problems with impulsivity, and then hyperactivity. So attention deficit hyperactivity disorder. Let me quickly say that we have various forms. So you may have those who suffer mostly with paying attention. So we call that one predominantly inattentive type. And that is very common in females. So in the class, they are sitting quietly, very good student, children, following what goes on in class, looking at the board, but they are not paying attention. You ask them what was said, and then they cannot tell you. So predominantly inattentive type. Then we also have the predominantly hyperactive type. That one is commoner in boys, you know, always running around, causing trouble, hitting people. But ask them what was said, they will tell you. So they don't have a problem paying attention. They just can't sit still. They are moving about, but they are listening to what the teacher is saying. Some of them are very, very smart kids, but they get beaten a lot because they will not sit quietly. And then we have the mixed type. So these are children, they will not pay attention, and then they will also not sit still, and it really affects their academic performance.
Wow, that's interesting. So how do we tell a child who has ADHD apart from someone who is maybe just distracted?
Okay. ADHD is a medical condition. So we say it's an organic problem. There's a problem with a part of the brain. And then we also have children who just want to be children. They are just running around. They are having fun. And they may have had a good meal. They want to play. But you see, children, as they grow, so 3 years, 4 years, they know that, okay, now I'm in school, I'm in church, I have to sit still. This is not the playground that I can run around. So those children who don't have ADHD will usually sit still when they go to a place where they know they have to sit still or behave. But those with ADHD, they don't know if this is church or this is home or this is school. They struggle paying attention or sitting still because it's a condition, it's a problem. It's not that they are faking it. So for us to even say that somebody has ADHD, whatever signs and symptoms you are seeing should not be just limited to one setting, maybe just the home. So if he's doing that at home, he should do the same thing at school, he should do the same thing at church. There was a child who was very, very hyperactive in church. One of my colleagues was telling me. And they realized that she nearly tagged him as ADHD. She realized that the parents were not expecting to have another child. So they redesigned their home, glasses and everything, because they thought they were done. And then this baby shows up. So they tell him, don't play in this house, you break things. So when he goes to the church, that is where he can be a child. So he runs around and all that. This child definitely doesn't have ADHD, because if he had, it will show in the church and then it will also show at home.
Okay, so when we look at between boys and girls, which group has it more? Is it more common in boys than in girls, or is there a balance?
So it depends on the one you are looking at. So mostly the inattentive type is usually seen in females, and then the hyperactive type is seen in males more. However, overall, you have more boys being affected than girls.
Okay. So you mentioned that for someone to be diagnosed with ADHD, they should have had it before age 12.
Yes.
But I think recently, especially on social media, TikTok to be specific, you see a lot of videos where adults are now realizing they have ADHD.
Yeah.
What is that? Does it mean they're having something different, or it could be ADHD but was missed?
Yes, that is the most likely reason, that there were signs even when they were younger, only that it wasn't picked up. And now, so ADHD, most of them would live with it into adulthood. There's a small percentage that may outgrow it in adolescence because the brain develops very rapidly during that time. So some of them may have a growth spurt in the frontal lobe, but majority of them live with it into adulthood. So chances are that they had it in childhood, but maybe we didn't know, so it wasn't picked up. It's now that they check the signs, and then they realize that we really may be dealing with ADHD. And the symptoms and signs in adults are slightly different. So you will not have an adult going to hit somebody, no. But they will be fidgeting, so they will sit still, they may have to do things with their hands, their legs, and they also have difficulty keeping a job because they usually will not complete their tasks and they will have problems with their bosses. So they may get sacked from this, or they get bored with that job and they want to move to another job, try something else. And the adults may also have risky lifestyle. They are impulsive, so they see this fine girl, they want to follow her. After a while, they need another one, they get bored with that person. They want to try dangerous things, the impulsivity and the hyperactivity and all that. So those are the signs you see in adults, and then the ones that you also see in children. So if an adult has ADHD, there's a high probability that he had it in childhood. It just wasn't picked up. And some of them are very, very good, very, very smart. When it's something that they really love, they can have 100% concentration over there, but every other thing looks boring. So you may have some doing very well in maths, but when it comes to English, the grades are very low. And some are smart, so they may get through school, or they may do averagely and then progress. And then when it gets to adulthood, where they have to really function, be productive, then they struggle. And then they may realize that, okay, these are symptoms. Now there's knowledge everywhere. People know of ADHD, so they may check themselves or see a professional and then maybe diagnosed with ADHD.
Okay, that's interesting. So are people with ADHD born that way, or do they acquire it along the way? And what are some of the causes and risk factors?
Okay. There's a highly genetic component to it. If somebody has ADHD, it is not far from the family. You just find somebody in the family who also has those features. It's just that they may tell you, oh, when your uncle was younger, he was very troublesome. Or one woman said, follow the son to the hospital because the grandson was very, very hyperactive and all that. And as the doctor was speaking and all that, the grandmother just said, my son was like this. That is how the father was like. So there's a very strong genetic component. If a child has ADHD, chances are that somebody in the family, the mother, the father, the uncle, a sibling, somebody also has ADHD. Of course, there are environmental factors that may also increase the risk. Whilst the baby is developing in the womb, if something affects the development of that part of the brain that controls impulses, focus and all that, there may be nobody in the family who has it. But because the formation in the womb didn't go so well, the child may be born with ADHD. If whilst born or during childhood, he suffers an injury or an infection, and then that also affects that part of the brain, the child may develop ADHD. And so even though there's a strong genetic component, there are also times that nobody in the family may have it, but it's during development of the child that they acquired it. Yeah.
Okay. Is there any correlation between ADHD and maternal intake of caffeine?
Okay. So caffeine for a pregnant woman is not good. Caffeine for a pregnant woman is not good. For now, we don't have a lot of research to support that as a cause. Okay, so we cannot say for sure that when a pregnant woman takes caffeine, the child would have ADHD, but there are more studies coming up. There are so many things that may be causing or contributing it to ADHD now that we may not know that they are contributing to ADHD, but maybe later research may come up with that. But caffeine for a pregnant woman is a no-no.
Okay, thank you very much. So what role do parents and teachers play in identifying the early signs that this child may have ADHD?
First of all, you should know the signs, and then you'll be able to pick them up. So teachers, very, very, very crucial role they play, because the child spends about 8 hours or even more with the teacher at school. When they come home, they are coming to eat, do their homework, take a bath, and then sleep. Okay, so teachers, we need your help here. There was a study done in Hohoi, and they realized that about 12%, so 12 out of 100 of the school pupils had ADHD.
Oh, wow.
So if it is a public school where you have a lot of children in one classroom, so about 50 people in one classroom, if you take 2 classes, class 1, class 2, you would have 12 children in that classroom. And are we picking them up? Or we are labeling them as stubborn and caning them? Now, thankfully, there is no corporal punishment. So teachers, you should know the signs. If there's a child who is easily distracted, you should be concerned, and then you talk to the parents. If there's a child who is failing in academics, that should also give you a heads up. If there's a child who is always causing trouble, their names are appearing in the names of talkatives. DP. No matter the punishment you give to this child.
Even TP, triple
TP. And the child is not reforming, it's not changing. You should start thinking that maybe it's not that just behavioral, it's not that the child just loves that. There may be a problem. So help that child, identify, and then let the child get help. If you have a child who is also sitting quietly in class, but you ask that child, what did I say? And they are blank. They can't tell you. The grades are failing. You should know that there could be ADHD in the picture. And then you'd have this child who just doesn't like some subjects. And usually it's the reading subject, because that's the one that will require that you sit down and then you focus. But they are doing so well, maybe music, arts, maths. You should also start thinking about ADHD, the possibility that this child may have ADHD. The child will not complete homeworks, or the exercise you give in class, instead of doing all 10, they do up to 5. And they leave the rest for you. Whatever you do with it, that one is not their problem. You should start thinking of ADHD. If you have a child who is always losing his things, so never having a pencil, you give the child one, the following day he comes back, there's no pencil. The books are disorganized and all that. Start thinking of ADHD. So these are some of the signs. So teachers, you can help us in that regard. And then parents too. It's not every child who is stubborn. Some of them may actually be suffering from ADHD. So they are unkempt. You give them chores at home, and they leave them halfway. As you are talking to somebody, a visitor comes there, and then they just blurt out something. They see anything, they want to say it. That you get friends coming over, they bring their children, they can just come in and say that, Mommy, why is it that your friend's son's head is so big? Right there, they will tell you that's how they are. Self-control is a problem for them. So if you have a child who is doing some of these things, just get the child assessed. They may or may not have ADHD, but it's better to identify the problem when they have it than for you to say that, oh, it may be nothing, and then later on you realize that it's ADHD.
Okay. So my next question is, before labeling a child as having ADHD, how important is it to get a professional assessment? Or can we just use the symptoms to say this child has ADHD?
Oh, not at all. That's a very, very important question. Otherwise, we will label a lot of children as having ADHD. Okay, so there's a way to diagnose ADHD. They must meet a certain criteria. We ask the teachers some questions. The parents also fill a questionnaire. Okay, and then of course the symptoms must have started before 12 years, and it should happen in more than one sitting. Okay, so we put these answers together, and then we diagnose a child with ADHD. So you as a non-professional will not be able to make a complete diagnosis. Even for the professionals, there are times that we say, okay, it's neither here nor there, we are not too sure. He doesn't meet a lot of the criteria, so let's observe a little bit for a while and see. So for somebody who is not a professional, it will be very difficult for you to come to a diagnosis of ADHD. Yours is to pick the signs and then refer to the appropriate score test for the child to be tested.
Okay, thank you very much. We will take a short break, after which we'll dive in and continue from where we left off. Welcome back to the show. For those who are just tuning in, the topic of discussion is understanding ADHD, and our guest is Dr. Gloria Amponsan-Kodia. Dr. Gloria, welcome back. So we'll take up from where we left off. My follow-up question is, are there some special tools and tests that are done to diagnose a child with ADHD?
Okay. For now, we don't have a lab test or some x-ray that we can do. It's what we observe the child do, what we hear from the parents, the teachers, or wherever the child, the other setting apart from home. And then we also see if he meets the other criteria, like the age, when it started, and all that. There are tests that can also test the function of the frontal lobe, the part of the brain that is involved in executive function. However, in Ghana, I don't know if we have those machines yet, but they can actually test the activity or the function of that part of the brain, and that can also help you to arrive at a diagnosis of ADHD. But for now, what we do in Ghana mostly is that we assess the child. We also have the parents fill a questionnaire, the teachers fill a questionnaire, and based on the score they get, then we can make a diagnosis or otherwise of ADHD.
Okay. So I know you said a lot about how some of them are not able to even pay attention in class, and some, even though they may be paying attention, but they have to hop from one place to the other. Mm. So does that have an implication on the ability to retain information and even reproduce it?
So some of them, yes. If they are not paying attention, especially the inattentive type, they are not getting anything. Once they are not getting anything in their minds, then they cannot reproduce it. And so those ones have very poor grades. And the same with the combined type. So they are not paying attention, and they are also hopping from one place to the other. So they also don't retain information so that they can reproduce it. The hyperactive type, those ones will retain information, and then they will tell you exactly, they will be able to reproduce it, only that they will just not sit still. And sometimes that hopping around may even be their way of processing information, processing things. So they'll be able to give you what you taught them, but not the other types.
So even for the long-term memory, they are still good with it?
Usually, for the hyperactive type. They don't have a problem with paying attention.
Okay. So how does this affect their social relationships?
Yes. Very, very, very important question. So even for the ones that do not have problems with paying, with catching the information, getting the information, you see, you can't just be in a place and be hopping from one place to the other, hitting somebody. You get into trouble. People don't like that. And you can't just be telling people whatever comes to your mind. Okay, if you feel that I have to say this is the truth, you just blurt it out. No, you get into trouble. So socially, it affects them. And if somebody is also doing poorly in class, so they may not be hopping from one place to the other, but they are not paying attention, and so their grades are failing, people usually would not want to associate with somebody who is not doing so well. So socially, they are also affected. So apart from the academic bits, socially, you know, we have our norms. You can't do everything that comes to your mind. So those ones, when they go to certain places, they suffer, they struggle, because then people may think that they have not been trained well. So socially, yes, it affects their development. And even when they grow with it into adulthood, it affects their work relationships. So in the office, they are the ones that are not usually liked because of how they behave. Okay, so socially, yes, it really affects them, both children and adults.
Okay. So please, what treatment options are available for them and how accessible are they?
Treatment options for now, ADHD, we cannot cure it, but we manage it. And we usually start with behavior therapy. So those with ADHD, you encourage them, you reward them when they are able to do something. You see, for the things that come to us naturally, they struggle to do it. And it's not their fault, it's how their brains are. So when they are able to perform a certain task and they do it so well, you have to reward them. You give them smaller tasks, work to do in a shorter time, and then you give them a reward. So reward system for behavior and therapy, we do that. And then we also have medication. So when it's so bad and the behavior therapy is not working for them, or they still need support, and especially as they grow older, they advance in their classes, and now they have to sit down and study more complex things. It becomes difficult for them to do. So you may have to support them with medication. What the medicine does is that it helps them to focus. It helps the function of that part of the brain to be optimized. So the medicine helps them to focus, focus through an activity, and then perform it. And it also increases their attentiveness. So usually, especially when they are younger, we want to do behavior therapy, see how that goes. And then if it's not working, or as they grow older, then we may have to put them on medication. There are times that for some who are even younger, you may have to put them on medication because the hyperactivity is so severe that they may injure themselves and injure other children. So you have to give them medication to calm them down. So we have those treatment options available.
Okay, so for the classrooms, are there some accommodations that can be done for these children?
Yes, there is. And let me quickly add that the medicine that they have to take is quite expensive. It's quite expensive, and it may also not be readily available in your pharmacy shops. But things are improving, so hopefully it will get better. In the classroom, the teacher has to be aware that this is the condition the child has. And you don't keep a child with ADHD close to the window. He won't learn anything. You keep the child with ADHD closer to you, your desk, so that you can keep an eye on that child. You don't position a child with ADHD among other kids who are likely to distract him. So where that child is in the classroom is very, very important. And then you may have to give him tasks that do not require a long period of sustained attention. Break the tasks down. Don't give them question 1 to 20. Let them do the first 5. When he's done, he shows it to you, you mark it, then you give the next one, the next 5. So smaller tasks for them to perform. And you may have to repeat things in class for the sake of that child. When you notice that that child is drifting off, you may just walk by the table and just tap the table. Don't say, pay attention, pay attention. The other kids will know that there's something wrong. You have to be creative, find ways of getting the child's attention back without drawing the attention of the other kids to him. And support. There are times, so at my institution, Healthy Kids Foundation, we have children whom we support in their schools. So what the facilitator does is that she or he goes to the child's school and then supports the child in the classroom. Sometimes it's difficult for one teacher in the class to manage the other children and this child with ADHD. So the person will have to support, keep this child's attention in class, and then from time to time pull the child out of the class and then go over what the teacher taught, because chances are that they got half of it, the other half is gone with the wind. So you have to bring that other half back and then help the child to learn them. So these are some of the things that you can do. Sleep is also very, very important for such children. When an adult, you even without ADHD, you don't sleep well. You know how things are. You can't concentrate very well. You are very irritable. If somebody steps on your toe, you can finish the lesson. And so this child who is already struggling to maintain concentration, if he's not sleeping well, that can be a problem. So teachers should be on the alert. They should go the extra mile for those children. Where they sit is very important. Repeat things as often as possible. Don't embarrass the child. They know there's something wrong. It's just that they can't control it. So if you keep saying you're not doing well, you're down, only you're not paying attention and all that, it also can dampen the child's spirit. So it's support they need in the classroom.
Okay. So for parents and caretakers at home, how can they also help improve their focus and attention span?
So sleep, I mentioned, is very important. Don't let them sit behind the TV for a very long time, especially the last hours before bedtime, because research has shown that the blue light that emanates from the screens can interfere with the chemical that induces sleep. So they will not sleep well if they are behind the screen for a very long time before they sleep. So sleep, very, very important. Let them have good nutrition. So wholesome meals, vegetables, fruits, reduce processed foods as much as possible. If you can even eliminate it, even the better. And then all these meals with preservatives and additives, food colorings, and all those things have also not been shown to help them. So good nutrition that has a lot of nuts and grains and legumes, green leafy vegetables. They are high in vitamin B, zinc, magnesium. These ones, meats, these ones also help the brain to function well. So good nutrition, sleep for adequate periods of time. And then when it comes to chores, break it down for them. Don't put so much on their plates at the same time. And it helps when you have a list or a structure, a schedule for them. So they know that when they wake up, I'm brushing my teeth, after that taking a bath and all that, just list it for them. If they can read, it helps them with the order. And encourage them. It's very, very important. You reward them. So for these children, there are things that they really love and they do well. So pair it with what they are struggling to do. If they don't like doing chores because it's so boring, it's mundane for them, but they love to play football, just tell them, oh, after you've done these chores, you can have 30 minutes of football. That is a reward. That will motivate the child to do well. And then with their classwork too, you have to support them. You have to, don't just leave them to do their homework. You come and then they are sleeping or they've gotten up to go and do something else and the book will be there waiting for you. Okay, so supervise them when they are doing their homeworks and all that. So these are some of the ways we can support them in the home too.
Okay, that's very detailed. Thank you. So can ADHD be prevented?
Because of the strong genetic link, unless you change your parents, so if it's the thing is in the genes, then it will be very difficult to prevent it. The other environmental factors we can prevent. So if you are taking folic acid as you are supposed to in pregnancy, you are avoiding chemicals in pregnancy, radiations, all the things that are harmful to the development of a baby. There's a possibility that you can reduce the risk, assuming that it's not genetic. There's nobody in the family who is carrying those genes. And you know, even with the genes, there are things that may make the genes show more or manifest more. So that is where the environmental things come in. So yes, the child may have that, but if you are supporting the child, reducing screen time, giving adequate nutrition, she's getting adequate sleep, then that child may not show as many of the symptoms or signs as a child who is being fed on processed food, is not sleeping well, is exposed to the screen all the time, and so on. So though you may not be able to prevent it 100%, especially for the ones that may be familial, so there's somebody in the family, there's a gene from the mother or the father that will be transferred or inherited by the child. There are other things that you can do to reduce how those genes express themselves. So that is what we see. And for those ones that are happening because the baby's brain is not forming well, not because there's a gene in the family, but because the pregnant woman is not doing what she's supposed to do or is exposing herself to hazardous things. If you avoid those ones, you can reduce the risk significantly or can even prevent it entirely.
Okay. So ADHD, is it always like a condition that stands on its own, or can there be some other comorbidities?
Yes, there can. You may have ADHD coexisting with cerebral palsy from a baby who suffered birth asphyxia. So the baby didn't cry or breathe well at birth. They may go on to develop certain complications, and then they may also have ADHD as well, because whatever is affecting the brain is also affecting the frontal lobe. And then you may also have ADHD existing with autism, a condition that is also gradually, we are seeing a lot more of that now. So ADHD can exist with autism. We can also have children with epilepsy who also may have ADHD. There are times that it may just stand on its own. The child is okay in every aspect, but may have attention deficit hyperactivity disorder.
Okay, thank you very much. We'll take a short break. Welcome back to the show. For those who just joined, we are discussing understanding ADHD. Dr. Gloria, so I've heard from different people, or let me say I've seen some stories circulating around that sugar has a role to play in ADHD. Is it true?
Sugar. So too much sugar is not good for anybody. Whether it's a child or an adult. However, as I mentioned earlier, ADHD is a problem of the frontal lobe. So for a child who has ADHD, whether he's fed with too much sugar or not, he'll still go on to show the symptoms of ADHD. You may also have children who, because they have been given a lot of sugary food, they have a lot of energy. They are just running around and all that. But when they are not given sugary foods, they are okay. They sit still, they are able to do the work that they've been assigned to do and all that. So you cannot say that because that child runs around when he gets a lot of sugar in the diet, he has ADHD. ADHD is a medical condition. It's an organic problem of the brain. So whether they are given sugar or not, or excessive sugar or not, they will still show the symptoms. The sugar may make it worse, or they may show more of the symptoms or severe features, but it's really not about feeding the child with ADHD with a lot of sugar. Sugar or not, they will show the symptoms.
Okay, so let's talk about technology. I know you've mentioned one or two about it, but technology as a whole, how is it impacting ADHD? Is it making it worse? Is it helping? Or can we use it to help?
Technology, it's like a double-edged sword. It can be positive, it can also be negative. When I was growing up, we were playing outdoors, so cooking in milk tins.
Yes.
And I was playing football with my cousins, my male cousins. We didn't have access to all these screens. Now the children, you have to force them to even go out and play. They prefer to be glued to the screen than to go outdoors and play. And there's research that shows that excessive screen time can affect a child's concentration, can even affect language development. So there are a lot of children now who have delayed speech, not because that is how they are in the family. Their parents were okay. The time they were supposed to speak, they spoke on time. But these children have delayed speech, all because they are not interacting with their peers. They are glued to the screen. It also affects sleep, and it also affects hyperactivity, makes them more hyperactive. So technology now, uncontrolled, is affecting the children a lot, and it's worsening ADHD. It's even, for those who don't have the genes, it's making them hyperactive. On the flip side, technology can also help these children with ADHD. Some of them don't like writing. It's boring for them. So can they type? Instead of they having a written exam, can they have a device where they can say whatever they want to say, and then it would record or write it, transcribe it for them? So that is technology. Is there a way of making activities more fun? Technology can also do that. Now there's AI, artificial intelligence is doing all sorts of things. We can leverage on that. When it's controlled, when it's well regulated, tailored for these children with ADHD, technology can help. There are those who love to draw, but they don't want to hold a pencil. They don't like it. Can we use technology to help them do wonderful paintings and all that on the computer? So technology can help, only that we have to manage it well. We have to know there are pros and cons, what we can do to protect them from the excess, from tipping over, and then just use the positive sides.
Okay, that's interesting, and thank you. So in Ghana, are there policies or programs in regards to identifying these kids with ADHD and even with the management?
There's supposed to be, so yes, there's a policy on paper. All-inclusive education. Children who learn differently should be in the same environment with those who learn, whom we call neurotypical, so who learn in a typical way. But in most schools, it is on paper. You even go to the classroom, and in public schools, common setting, what you see, there are about 40 or 50 people in the class. The teacher is overwhelmed. He's just waiting for 2 o'clock to strike or 2:30, and he'll pick his bag and then leave the classroom. So how then do you even help this child with ADHD? Or the place is so hot, everybody is doing something, everybody is bored. Those with ADHD, they are bored. Those without ADHD are also doing their things. So how do you even identify that child who has ADHD? So we have to do more. We have to do more in our classrooms. The private schools are doing better in terms of class size, but their teachers have to be trained also to identify these children with ADHD. And then we have to be able to modify the classroom setting to help the children with ADHD to still be able to learn and not be easily distracted. One thing that helps them is peer support. So you can, as a teacher, you can pair a child with ADHD with another child who doesn't have ADHD, and that child can support that with ADHD in the classroom. So we have to do a lot. We are doing some. We have progressed a bit because 20 years ago, 10 years ago, how things were in the classroom, there's been some improvement, but we still have a lot to do, especially in our public schools, especially. And you see, the sad thing is that the private schools that may be able to provide the resources to cater for these children, I also don't want to go through that stress of having to redesign their classroom just for 1 or 2 children. So that also doesn't help them. We have to move towards inclusivity in our communities, in our classroom for these children. But we're still quite a long way from achieving that. But hopefully we can do that. Government can also come in. Government can also come in because you have the policy. Are you enforcing it? Are you ensuring that all the schools are keeping that? If you hear that a child has been denied access to a school or admission into a school because that child has ADHD or he learns differently, what do you do? When they report that case to you, what do you do? So enforcing ensuring that people are going by the policy is also important. So that is where government has to come in. And then, of course, health workers too. We must educate ourselves. We must know that these conditions, it's not only malaria we are treating. Now we have these conditions coming up. So educate yourself so that when they bring the child to you, you can do a proper assessment and then provide the help that this child needs. So we are doing well, but we still have a long way to go.
Okay, so a quick one before your final words. Do you think that children with ADHD should be put in special schools?
We want an inclusive society. We want an inclusive society. Sometimes these children just require a bit of support, extra support, and they can fit very well into the classroom. There are times that some may also have very severe symptoms. So those ones, you want to manage that child a little bit, help with some one-on-one learning, tuition, help with medication or therapy to ensure that now he's calmer before you put him in class with the other kids. Otherwise, they'll go to the class and they'll beat everybody, including the teacher. You understand? So it depends on the severity of the symptoms. There are some who can fit very well with a little bit of support. Some of them, you don't even need an extra person. The teacher may be able to handle the child together with the others in the class. And then there are also some that require a bit of one-on-one care until we transition them into the classroom. And even for the adults who also have ADHD, their employers will also have to be sympathetic and a bit empathetic. But especially if they get to know that this person suffers ADHD. So the task that you give to that person, there are ways that you can identify the strengths of that person and let him handle those ones. Don't give him the work that involves a lot of social things. So where he has to socialize with people, he may go and disgrace you. But they always have something they do very well that they love to do. And that one they do very well. So when you identify that at the workplace, you can let that person handle that one for you.
Okay, thank you very much. So our time is almost up. Your final words to any parents or teachers out there who are dealing with children with ADHD?
Yeah. Parents should know their children. You should educate yourself so that you can pick some of these signs and then address them. Some of these children go on to do very well if the right treatment is given. If the right treatment is not given or they miss it, they may grow up and involve themselves in very risky behaviors, and they will be not as productive as you want them to be. The child, you would have an adult who is always bringing you problem. The police are calling you, the neighbor is calling you and all that, but that person could have been helped. Maybe just put on medication and he would have been okay. And then in the classroom too, our teachers, they are with you for the most part of the day. So know what ADHD is, identify the symptoms, and then recommend them to where they can get help. And please support them in the classroom. It's very, very important.
Thank you very much, Dr. Gloria, once again for honoring our invitation and for educating us on ADHD. It has become quite popular recently, especially even among the older people. Yeah. So it's nice to know that there is more that can be done about ADHD.
Yeah.
And now to our viewers, we now know that ADHD is not just about distractions and restlessness. We know it is a neurodevelopmental condition, and it can affect learning, it has behavioral impacts and all that. And so now is the time for us to pay attention to our kids, spot the signs early, and be able to take them for the care that they need. Thank you very much for joining us today. See you again next week.